Hello everyone, Assalamu alaikum. Welcome to Agmedics Live. আশা করি আপনারা সবাই ভালো আছেন. So today is our sixth class of Language of Medicine comprehensive course. So let's get started with chapter 6, which is going to be urinary system. So chapter 6, urinary system. So the objectives today are introduction, anatomy and physiology of the urinary system, symptoms of the urinary system, pathological conditions, laboratory investigations, and some important abbreviations. So the urinary system or the renal system or the urinary tract, okay, you can actually use it synonymously, consists of the kidneys, ureters, bladder, and the urethra. Now the purpose of the urinary system. So before that, let's have a look at the image. So in chapter 1, we already discussed about the structures. So this is the anterior view of the abdomen, and this is the posterior view of the back. Now in the anterior view, you can see this is part of the abdominal cavity, okay, and inside in the lumbar region, okay, or the loin region, we have a pair of kidneys. Now this is the left kidney, this is the right kidney. From the kidney, you can see a pair of tubes leading downwards towards the sac-like cavity. This is known as the bladder. And from the bladder, another tube is leading towards the outside. This is known as the urethra. Now, what happens inside the kidney? Urine production occurs, okay? From there, the urine is being carried through these tubes known as the ureters towards the bladder. Inside the bladder, the urine is stored. And whenever the urinary bladder expands and the urge is felt, that time what happens? The sphincter opens, okay, or the gate of the bladder opens and urination occurs through the urethra. So these are the four structures present in the urinary system, okay. So number one is kidney, then we have the ureters, then we have the urinary bladder, and the fourth one is the urethra. And if you consider the other image, okay, the back side, you can see the kidney is actually located more towards the backside, towards the backbone rather than in the front. So basically it is a retroperitoneal organ. What does retro means? Behind. Behind the intestine or behind the digestive organs, kidney is located and it's more towards the backbone. Now these are the lumbar vertebrae. If you can recall chapter 2, okay, we did the parts of the vertebra. At first we had cervical vertebra, then we had thoracic vertebra, then we had lumbar. So near the 5 lumbar vertebrae, the kidneys are located. Okay, can you notice one thing? The right kidney is slightly at a lower level than the left kidney. Why is this? Because above the right kidney, we have the liver, right? The liver is located on the right side. So what happens? The liver slightly pushes it downwards. Okay, so the right kidney is slightly lower than the left kidney. Okay, now let's get back to the first slide. So what is the function of the urinary system? So number one, it eliminates the waste substances by producing urine. But how does it produce urine? It actually filters the blood, okay? So the blood enters the kidneys, from their filtration occurs, and the urine or the excretory substances are being excreted. Next is it also controls the blood pressure, okay, the blood volume and subsequently the blood pressure. The third is the levels of electrolytes. So what are electrolytes? The sodium, potassium, fluoride, bicarbonate, hydrogen ion levels. These are being controlled by the urinary system. Next we have the pH, okay, whether the pH of the blood is acidic or alkaline, this is also being controlled by the kidneys. And the last one is this produces some important hormones, okay, which we'll discuss in the next few slides. So these are the functions of the kidney. All right, now, so as you can see, initially we had a view of the ultrastructure, okay, or the macroscopic structures. But now we are going to go into a little bit of details, which is going to be the microscopic structure. So this is a kidney, okay, and this portion is being magnified here. Now, this structure, as you can see, this coiled tube, this is known as the nephron. So, the unit of kidney or the functioning unit of kidney is known as nephron. There are millions of nephron inside the kidney. But what does this nephron do? They do the filtration. So, whenever the blood, which contains all the waste products, enters the kidney, the nephron basically does the filtration and removes all the toxins and passes it as urine, and the remaining important substances are being returned towards the heart or towards the blood. Okay, so as you can see here, at first the blood enters the nephron, okay, and through this tube, subsequently what happens? Some reabsorption occurs. Okay, the important substances are being taken away and the waste substance are being excreted, okay, as urine. So what are the important substances that we need to get retained inside our body? So these are glucose, okay, amino acid or proteins or albumin. One of the important protein which you have to remember is albumin, okay, albumin. And the third is electrolyte and then water. So the reabsorption of water actually depends on the climate, okay. If it's a hot climate, if the person is dehydrated, more water will be retained. But if it's like in winter or the temperature is cold outside, so in that case less water will be retained. So the important substances which are being retained are glucose, protein, amino acid or albumin, electrolyte and water. And these are the substances which are getting to be excreted or secreted through urine. So number one, the waste product is urea, then we have uric acid and creatinine. So these are the important waste products. Now what is urea? Urea is basically a byproduct which is being metabolized in the liver. Okay, so what happens after the substances enter the liver? These are being broken down and the ultimate product is the urea. Urea usually kind of disturbs the homeostasis of the blood, so it has to be excreted. So as a result, what does kidney do? It excretes it through the urine. All right, so let's have a recap of the first few slides. So at first we discussed what is urinary system and what are the other synonymous terms for that. So renal system or urinary tract. Then we discussed about the functions. So one of the important function is filtration of the blood to produce urine. Second is blood pressure regulation, control of the blood pH and electrolyte levels, and lastly the hormones. Next are the location of the kidney. In that case, kidney is located inside the abdominal cavity, mostly in the lumbar region or near the loin region. All right, and it is more towards the dorsal end rather than the anterior end. So as you can see, it's more towards the backbone. And the right kidney is slightly at a lower level than the left kidney because above the right kidney we have the liver pushing it downwards, and the important structures of the urinary system, we have the kidney, we have a pair of ureter, a bladder and a urethra. All right, okay. Next, the ultrastructure of the kidney. We have the unit of kidney known as the nephron. There are millions of nephron. The function of nephron is filtration. So the important substances are being retained and the waste products are being excreted. So the waste products which are being excreted through urine is urea, uric acid and creatinine. And the important substances are glucose, amino acid, electrolyte and water. So in case of amino acid and protein, you have to remember the term albumin. Okay, albumin. All right. Now, question for you all. So, which of the following should not be found in urine? So, the question is, which of the following should not be found in urine? There are four options. Number one is albumin. Number two is water. Number three is creatinine. And number four is urea. So, please, if you know the answer, mention your answer in the comment box. I will be checking your answer at the end of the session. All right. Okay. So next is, as you can remember, we discussed in the previous slide that one of the important function is hormones. Okay, so what are these hormones that are being produced by the kidney? Let's have a look. So one of the hormone is vitamin D. Vitamin D is basically a vitamin as well as a hormone. So what happens actually? So vitamin D is being produced by the kidney and it basically controls the blood calcium level, okay, the calcium level inside your blood, and also it impacts our immune system. So initially what happens, the skin absorbs the vitamin D in inactive form, okay, and synthesizes it in inactive form, and later it is being activated, or the kidney produces the active form, which is biologically active, which means it is ready to function now. All right. So initially, what happens through the sunlight, with the help of the sunlight, the skin synthesizes the inactive form of vitamin D, and the kidney converts it into the active form. So what happens after being activated? It does its functions. So what are the functions? Maintaining the calcium level in the blood. Okay. All right. So I'll repeat the question once again. If you know the answer, please mention the correct answer in the comment box. So the question is, which of the following should not be found in urine? Which means, which, okay. So the options are albumin, water, creatinine, and urea. Okay. So mention your answer in the comment box. Now the next hormone is renin. Number two, the next hormone is renin. So the first one was vitamin D, and the second hormone is renin. All right. So what does renin do? You don't have to know details. In one word, you have to know that renin helps in maintaining the blood pressure. So as you can see, when the blood pressure falls, what does renin do? It increases the blood pressure. All right. The third hormone, erythropoietin. All right, erythropoietin sounds really difficult, but it's going to be easy if you repeat this live again and again and go through the terms. All right. So erythropoietin, what does it do? So initially, our bone marrow is basically a jelly-like substance inside the bone. Okay. This bone marrow produces cells. One of the cells is red blood cell, RBC, or erythrocyte. Okay. So what happens? This erythropoietin helps in maturation of the red blood cell. If the red blood cell is not mature enough, it won't be able to transport oxygen. So it's very much necessary that the hormone acts on the red blood cells and converts it into the mature form. Okay, so these are the three hormones. The first hormone was vitamin D. The second hormone is renin, which controls the blood pressure, and the third is erythropoietin, which helps in maturation of the red blood cell. Okay. All right. Now let's move to symptoms. What are the symptoms of the urinary system, which is basically what will the patient present with? All right. So the first one, urination. Now urination is basically a layman term. In that case, the medical term for urination is micturition. Okay, micturition. Second is difficulty urinating or painful urinating. Now, if you can recall chapter 1 and 2, we discussed few terms, right? Like dysphagia, dyspepsia. So what does dys mean? The prefix dys means difficulty. Okay. So if you consider this term, dysuria, it means difficulty in urination. Urea is actually the root word here, okay, relating with urination. So dysuria is the difficulty in urination. Now, why would a patient have dysuria? Suppose if a patient has urinary tract infection, or maybe some kidney conditions, at that point spasm of the muscles of the urinary tract occur. As a result, the patient has very painful micturition. The third term is presence of blood in urine. Okay, sometimes patients present with dark colored urine, or maybe there are a few droplets of blood with the urine. Okay, so this term is known as hematuria. Hema means blood. Okay, and you can see the root word urea is common here. The fourth term is polyuria. If you can recall endocrine system, we discussed polyuria. Poly means excessive and urea means urination. So if a patient has excessive urination, example in diabetes mellitus, right? We discussed about diabetes. So in that case, polyuria can occur. Then we have urinary frequency and hesitancy. Now, what does frequency mean here? The patient is passing urine very frequently, okay, or frequent urination. And what does hesitancy means? The patient is trying to urinate, but he is unable to. So unfinished urination or feeling of incomplete voiding. Voiding is also another term for urination, okay. Next symptoms, albumin in the urine. Okay, so albumin is an important substance, right? A protein. So if it cannot get excreted, so if albumin is present in the urine, which means the patient has some disease in the kidney. So the term is albuminuria. Next is presence of glucose in urine. So that is glycosuria. Usually patient with diabetes presents with glycosuria. All right. Then we have pus in the urine. If a patient has urinary infection, in that case, if urine test is done, usually presence of pus cell is present and the urine appears to be cloudy, okay, a bit turbid like. So that term is known as pyuria. Pi is basically relating with pus and urea is urination. Now, next important term is absence of urination, which is known as anuria. Okay, A means absence and urea is relating to urination. And lastly, the important one, unable to control the urine or urge to micturition, that is known as urgency. So if a patient has urine infection, usually the patient is unable to control it. That condition is known as urgency. So let's have a look at the symptom once again. So we had micturition, we had dysuria, hematuria, polyuria, frequency, hesitancy. Then we had urgency and important substance related to, we had albuminuria, glycosuria, pyuria, and anuria. Okay, usually patient having renal failure or renal shutdown. In that case, anuria is the term to be used. Okay. Now, one thing you have to remember whenever a patient presents with the symptoms, usually what the doctor do, they kind of denote all the signs, right? Now, which system will be examined in case of urinary system? So usually the abdominal region, or to be more specific, the genitourinary region, this region has to be examined to find the signs. Okay. All right. So this term I will discuss at the end of the slide. So let's move on to the next one. Now the conditions, pathological conditions or diseases. So the number one infection which is most common in case of female is urinary tract infection or urine infection. In short, we call it UTI. So a patient with UTI will present with high grade fever, okay, usually 101 to 104. And there is severe shivering and the patient will have difficulty in urination, which is dysuria. Vomiting can be there, which is optional, maybe or may not be. And the patient will present pain in the loin region or in the lumbar region. Now, usually what happens, pain is not always located in the lumbar region, could be in the lower abdominal region as well, okay? Basically, where the bladder is located, all right? And also in case of severe urinary infection, patient can present with hematuria, which means there is blood in urine, okay? So in severe cases. Now, what is the main cause, okay? Who is the vector here? Who is causing this infection? So basically this bacteria known as Escherichia coli, and in short we call it E. coli. This bacteria is responsible for the urinary tract infection, okay? As you can see in the picture, this zone is being highlighted in red color, which means there is infection here. And as you can see, there are plenty of bacteria here, and white blood cells, the WBCs, are here to fight the bacteria. Okay, so the first infection is UTI. Second infection, we have nephrolithiasis. Okay, now before going in details, I'll show the picture at first. So as you can see in the image, this is a structure of the kidney or section of the kidney. This is a section of the bladder, and this is the ureter. Okay, now here is a stone present inside the kidney, and here you can see inside the ureter, and the third one inside the bladder. Okay, so depending on the location of the stone, we usually use the term. So if you see the next slide at first, so here the term litho means stone. So nephrolithiasis is basically related with stones. So litho means stone. Now, if you consider nephro, the word nephro means kidney, okay? Because there is nephron inside the kidney. So likewise, you can remember it. So nephro means kidney. So if there is stone in the kidney, this is known as nephrolithiasis. So if there is stone in this region, okay, in that case, you can call it nephrolithiasis. But if the stone is located in the tube, which is the ureter, in that case, we will call it ureterolithiasis. So depending on the location, all right? Third is cystolithiasis. Now, what does cyst here mean? Cyst means bladder. Remember in chapter 1, we discussed about that. So if the stone is present inside the bladder, this is known as cystolithiasis. All right. Now, what is urolithiasis? Now, uro actually means the whole urinary system. Okay. So stone present anywhere can be as a whole called urolithiasis. But if you want to specify each segment, in that case, you can change the name likewise. So example, nephrolithiasis, ureterolithiasis, and cystolithiasis. Okay. Now the synonym for stone is also known as calculi. Okay. So lithia, stone, calculi, all are synonymous. Now let's move on to the previous slide. So nephrolithiasis, urolithiasis. So usually what happens if a patient presents with kidney stones, they have severe pain in the abdominal region. Usually it's from loin to groin region, okay, from abdomen to the groin region. And secondly, there could be a severe burning sensation in micturition or urination, and the patient can or might have high grade fever, but it's again optional, and vomiting can be there or may not be there. Now, what happens if the stone, if it's small in size? In that case, the doctor advises the patient to drink plenty of water and do some jogging. Okay, in that case, what happens? The stone passes away with the urine. But if the stone is large enough, and if the x-ray or the other investigation reveals that the stone is very big and it cannot actually pass through the urethra, in that case, what happens? We go for operation, okay, to extract the stone. All right. Now, why does stone form? Now, there are several reasons. Okay, there could be nutritional deficiencies like vitamin A deficiency, or there could be infection, patient having consistent or persistent urinary tract infection, or has low volume of water and high concentration of salt. Okay, so there are several causes. For pre-ST phase, you don't have to know in details. I'm just discussing that for the purpose of understanding. So in that case, what happens? The stone forms. Okay, stone can be uric acid stones as well. Okay, and calcium stones. There are two types of stones, and other types can be there. So this whole part of stones formation in different parts together is known as urolithiasis. Okay. Now, the third disease is diabetes insipidus. So, in the previous slide, there were questions, what is diabetes insipidus? So, today I'm going to discuss it. So, you already remember what diabetes mellitus is, which was related with insulin, right? Which was released from the pancreas. Now, in case of diabetes mellitus, if you can recall, we remembered the symptoms by 3P, right? Polyuria, polydipsia, and uh, polydipsia, and the other one was, sorry. So the three symptoms which we discussed was polyuria, polyphagia, and polydipsia. Okay, but in case of diabetes insipidus, there is exception. Now, why would polyphagia occur in case of diabetes mellitus? Because the glucose is being excreted, but in case of diabetes insipidus, there is no relation with glucose or insulin. Okay, so in that case, what happens? We don't have polyphagia in this case. So the patient will have only two symptoms. One is polydipsia and the other one is polyuria. Now let me discuss in details. As you can see, this is a normal patient. The pituitary gland releases the hormone ADH or vasopressin. Now what does ADH do? It controls the level of water inside the blood, okay, and less urine is being produced. But if a patient's pituitary gland doesn't release enough ADH, then what happens? Okay, in that case, due to deficiency of ADH, the urine becomes concentrated or less volume of urine is being produced. So the patient, sorry for my mistake. So if a patient doesn't have enough ADH, what happens? Excess urine is being formed. Okay. So if excess urine is being formed, this term is known as polyuria. Okay. Polyuria, poly means excess. Now, if a patient has excess urination, this could lead to severe dehydration and thirst, and the term for excessive thirst is known as polydipsia. Okay, so in case of diabetes insipidus, the symptom is 2P. In case of diabetes mellitus, it is going to be 3P. The hormone responsible for insipidus is ADH, and the hormone responsible for diabetes mellitus is insulin. So this is the two difference which you can remember. Now, the last and the fourth disease is diabetic nephropathy. Okay. So as you know, if you break down this word, nephro means the kidney, pathy means disease. So a disease of the kidney which is due to diabetes. Okay. So what happens in diabetic nephropathy? So suppose a patient has, uncontrolled diabetes, okay, or severe diabetes, blood glucose level is very high. Okay. So in that case, as you can see, in a healthy kidney, all right, in a healthy kidney, there is no passage of protein or important substance in the urine. But in an unhealthy kidney, the protein is leaking outside, which is mostly albumin. So this is a picture of a diabetic patient. So in diabetic patient, due to high level of glucose, it damages the nephrons, okay, the filtration system. As a result, what happens? The protein gets leaked out and there is proteinuria. Okay. Similarly, glucose also passes through the nephron leading to glycosuria. So if patient has untreated or badly managed diabetes mellitus, high level of glucose in the blood gives it a very thick or syrupy consistency, and this high level of glucose can damage the nephrons, leading to proteinuria or albuminuria. Okay, so let's have a recap what we discussed till now. So we discussed about the introduction, which is the urinary system, okay, or renal system or tract, and the functions, so which is mostly formation of urine by filtration mechanism, controlling the blood pressure, pH, and electrolyte, and lastly the hormones. Second is the image of the urinary system. Okay, so the four parts is kidney, ureter, bladder, and urethra. And the right kidney is at a slightly lower level than the left kidney, and it is mostly retroperitoneal. Then we had the functional unit of the kidney known as the nephron, and the important substances being reabsorbed are glucose, amino acid, protein, albumin, electrolyte, water, and excreted are mostly urea, uric acid, and creatinine. Then we discussed about the hormones. So number one is vitamin D. So the kidney produces the biologically active form of vitamin D. It also produces renin to control the blood pressure and erythropoietin to help in maturation of the red blood cell. Next, we discussed about the symptoms, so which is difficulty in urination, dysuria. The synonym for urination itself is micturition. If blood is present, we call it hematuria. If there's excessive urination, like we just discussed, diabetes insipidus and mellitus, patient will have polyuria. If a patient has increased frequency, like in UTI, or if there is incomplete urination, in that case, we use the term frequency or hesitancy. Next, we discussed about the presence of important substance in urine like albumin and glucose. And then if a patient has infection, usually there is presence of pus cell known as pyuria, and absence of urination in case of renal failure. This is known as anuria. And lastly, urgency, which is basically unable to control the urge to urinate. Then we discussed about the diseases. So the very common disease, mostly in female, is urinary tract infection, and the abbreviation is UTI. Mostly this is caused by the bacteria E. coli. Okay, and the patient will present with severe pain while urination, which is dysuria. There has to be a high-grade fever, shivering, vomiting, and pain could be in the lumbar region as well as in the lower abdominal region. Okay. Next, we discuss about formation of stone in the urinary tract, which is urolithiasis, and depending on the site, we divide it into 3 or 4 sections. So one is nephrolithiasis, then we have ureterolithiasis because in the ureter, and lastly in the bladder we call it cystolithiasis. Okay, and we discussed about why stone forms, but this is not important for pre-ST. Okay. Next is diabetes insipidus. So we discuss the difference between insipidus and mellitus. So in case of insipidus, the hormone responsible is ADH. So the pituitary gland doesn't secrete enough ADH. So what happens? Water is not being retained and it passes through urine in excessive amount. So which leads to polyuria and the patient gets dehydrated, leading to polydipsia. But unlikely in case of diabetes mellitus, which is basically 3P, and polyphagy is because insulin is not there and glucose passes through the urine. So the difference is 3P in case of mellitus and the hormone insulin, and 2P in case of insipidus and the hormone is ADH. And lastly, we discussed about diabetic nephropathy, which is disease of the kidney due to uncontrolled diabetes. So what happens? Important substances passes through the urine like glucose and protein, leading to proteinuria and glycosuria. All right. Now let's discuss about the investigation or tests, okay, which are going to be performed if a patient presents with renal condition. So the basic test we discussed initially as well, which is CBC, complete blood count. Okay, so if a patient presents with suppose hematuria, which is like basically blood in urine, so in that case we go for the RBC check. In the CBC count, we have to check whether the RBC is all right or not, the hemoglobin count is fine or not. Okay. Second is urine analysis. So if you break down this word, it's urine analysis. So together we call it urine analysis. Okay. So in that case, what happens? The urine sample is taken, the color, the pH, the presence of protein, glucose, these are checked. And for infection or for passage of blood, we check the pus cell and RBC. And usually gravity indicates if there is bits of stones present in there. All right. Next, for the kidney function, we check the serum creatinine, which actually indicates the functioning ability of the kidney. And then we go for uric acid. If patient has high uric acid, this condition is known as gout, which we will discuss in our next chapter, which is going to be musculoskeletal. And if a patient has high uric acid, there could be presence of uric acid stones. Then we can do blood urea nitrogen. In short, we call it BUN. Okay, so this is not the bun for eating for burger. Okay, so this is a different bun. So capitalization. So blood urea nitrogen. Next, we have X-ray. So in this case, X-ray should be done of the kidney region. Okay, so this is known as KUB, kidney, ureter, and bladder. So we mostly focus the kidney region rather than focusing the whole abdomen. Okay, so X-ray is a radiation, so there will be less exposure if we focus on the KUB region. Then we have ultrasonography and CT scan, MRI. So these are the common tests which are being done. So initially we go for the CBC, then the urine test. If there is some abnormality, then we'll go for the further test. Creatinine usually indicates the functioning ability of the kidney. And if a patient presents with stones, in that case, we can go for extra CT scan. All right. So these are the common tests which are being done. Next, let's have a look at this image. So as you can see, this is an image of an extracubi region. Okay, so here the kidney is located. The 5 lumbar vertebrae, as you can see, 5, 4, 3, 2, 1. Okay, so these are the 5 lumbar vertebrae, and these are the ribs. Okay, this is the 12th rib. This is the 11th rib. The kidney is located, as you can see, the outline. Here is one kidney, and the other kidney is here. Okay. All right, so this whitish region, this is the stone. Okay, this is the kidney stone, or in medical term we can call it nephrolithiasis. Kidney is located in the kidney. Sorry, stone is located in the kidney. Okay, and the bladder is located here, and these are the two hip bones. Okay, all right. So now after operation, as you can see, this is the stone which has been extracted. Okay, all right, so this is the kidney stone, and since it's radio opaque, which means it's visible in the x-ray, this highlights as a whitish region. All right, so next let's have a look in the next image, which is going to be extra KUB2. So this is also a same KUB region image, but this is of a different patient. As you can see, this is the lumbar spine. These are the two hip bone. This is the sacrum. Okay, we discussed in chapter 2. Bladder is located here, and you can see multiple stones here. Okay, many stones here. All right, so these are the stones extracted post operation. Okay, all right. Now let's discuss about the important abbreviations. Okay, we have ADH. Most of you could answer it in our last session. So antidiuretic hormone or vasopressin. Then we have BUN, which is blood urea nitrogen, UA, or urine analysis, which is basically the urine test, UTI, urinary tract infection, GU. Now, I remember discussing it previously. So, GU is basically genitourinary. So, whenever a doctor wants to examine a patient with urinary problems or kidney problems, in that case, the doctor examines the GU system or genitourinary system. So, mostly the genital part and the urinary part. Okay, so together, genitourinary. And then these are the common abbreviations we discussed in previous chapter as well. So which is sodium, Na, and potassium K. So these are electrolytes as well. All right. Okay. So let's have a recap from the symptoms. Sorry, the laboratory investigations. So we discussed about the tests, which is CBC, urine test, blood test. In case of blood test, we use the term serum. Okay. Then we discussed about other images, so X-ray and CT scan. Here X-ray is used. In case of ultrasound, we use sound waves, and this is magnetic resonance. Okay. Then we have discussed about these images. This is the X-ray KUB region, and you can see the stones here. So after operation, the stone has been extracted, and these are multiple stones, and we discussed about the abbreviations. Okay, now let's have a look at the questions for today. Okay, so the answer is yes, the answer is albumin. Very good, because this is an important substance. We cannot excrete it with the urine. Okay. So the other options were creatinine water. So creatinine is a waste product. It has to be excreted, and water depends on the climate. So if it's like hot, more water is going to be retained and less urination. And if it's cold, more urination. Okay, all right, very good, well done. Okay, why stones form? Yes, I discussed it in the live already. So there could be many causes. So if you consider vitamin deficiency, vitamin A, okay, if there is less vitamin A, more epithelial tissue forms there could lead to stone formation. And if there is an infection, suppose UTI, in that case, stone formation can also occur. And thirdly, if a patient has less volume of urine or drinks less water, and there will be more concentration of solutes, so the salt crystallizes. And the other reasons could be if a patient has high uric acid level, okay, so in that case, uric acid stones can form. And if a patient takes excessive calcium supplements, okay, in that case, excessive calcium could lead to hypercalcemia, and from there, the patient can have calcium stones. So these are the common reasons of stone formation. For priests, you don't have to remember that. It's just something I discussed because it seemed important to have knowledge about this. All right. So let's move back to the slide once again. All right, so it's very important, to be very consistent in whatever aspects you're working, because if you are consistent, it could lead to a great routine and a flawless schedule. So having a great routine and schedule is a key to success. All right. So in that case, if you really want to pursue something, it's very important having a definite goal and having a clear vision, staying positive, and tackling all the procrastinations you have. It's like doing later, maybe tomorrow, and the next day after. So you have to control the procrastination effects, right? So in that case, if you can stay consistent and have a goal, I think you can be unstoppable. All right. Anyways, thank you so much, everyone, and inshallah, in the next class, we will be discussing chapter 7, which is going to be musculoskeletal 7, and it's also going to be the last chapter for the comprehensive session. And in the next session, I will be providing you the final course assessment quiz. So make sure you prepare well and follow all the lives and try to get a note of yourself, like each live you see, try to make a gist of the lectures. All right, so for now you don't have to get into too much details, but try to have a basic outline of all the contents. So once you come to a training, it's going to be easy for you to comprehend and make your own document. All right, thank you so much, wish you all the best, and see you soon. Take care, and Allah Hafiz.